A leading dental surgeon in Cancun, Mexico, demystifies the difference between immediate load and traditional dental implants.
So about immediately loading implants, this is a technique that statistically in the literature, they have the same success as delayed load implants. When do we do immediate loading? So most of the time, if we're doing a full arch and you're placing 4 to 6 implants or 8 implants depending, most of the time you can do an immediate load. And the benefit of this is great because a lot of patients have still some remaining dentition when they come. And of course, if you're gonna give them a set of regular dentures, they're gonna be miserable for a while because getting used to something removable is not easy. So in most of these cases, what we do is we extract the teeth, we place the implants, and we attach the prosthesis to those implants in the same appointment. This, of course, is a temporary prosthesis. And this prosthesis will be changed in 4 to 6 months after that procedure is done. But part of the advantages of this is that the patient walks out of here with a fixed set of teeth. They have to be careful though. For the first couple of weeks, they're going to be on a completely liquid diet and then on a semi-soft diet for another 6 weeks. This is the protocol we need to follow to ensure that we won't be jeopardizing those implants. And then after that, they go back to regular life with a regular chewing and everything. And then, like I said, 4 to 6 months after that, they come back. So it's a 2-trip thing. And then we can change the prosthesis for a final prosthesis. What is the difference between the temporary prosthesis and the final one? The temporary prosthesis is made out of acrylic completely because we have to create it at the time of surgery. When we do the final prosthesis, these final prosthesis have a metal substructure that's folding to the implants, and then it's wrapped up either in could be porcelain or acrylic and denture teeth, either or, depending on the case too, again, and depending on what the patient wants. And for single implants, for example, in the anterior segment, we always do immediate loading when it's possible. But we need to assess and make sure that the patient is a candidate for that with a CT scan. If the patient is a candidate, the best way to preserve those tissues is to do an immediate load because once you place the implant at the time of the extraction, you will create a temporary that will have the form of a tooth. And this will help to preserve the tissues, both the bony and the soft tissue, in a perfect way. That will enhance the aesthetics, of course, of this restoration. That in the anterior segment is something that's indispensable. You have to have the aesthetics. Some patients have a low smile line and they won't show it, but still, you want to have something that's matching all the natural teeth, and that is the way to do it. And again, this type of loading in single implants, we will do that temporary, that will be made out of acrylic again. And a few months later, 4 to 6 months later, we will change that for a porcelain crown.
Got questions? We would love to hear from you in the comment section below. Tell us what else you want us to cover. And do not forget to share and like this video.